I'm Caron. I am a physical therapist. I have been a physical therapist here in the Seattle area since 2008. And so I'm really excited, this opportunity to be able to, meet people where they're most comfortable and, being able to come into the home and, get that one-on-one care, especially at that time of life, as you're going through a pregnancy, maybe you're working and you have a toddler, and just getting out of the house is quite a chore. So being able to have someone come to the house, I know I would have given anything when I was having my 4 kids to have the opportunity, because I know I took a back seat. I didn't have the same, I probably went to a dentist, once every 2 years, because again, it was hard to get out of the house and trying to line up childcare and trying to find times when my husband would be home to watch my kids. That was always a tricky piece of, when my kids were young. And so being able to take that concern away, I think is awesome, because it's just so, I know that it can be a big barrier, especially during that 4th trimester, because you're trying to kind of make sense of, if it's their first time, trying to make sense of how to even get your baby out of the house. And so asking someone to come into the clinic a lot of times is difficult. And I've found that in the past that, babies don't always align with our scheduled visits. And so maybe they're sleeping and maybe there's a diaper change right before your appointment and you're trying to get out of the house, but you just can't make it there in time. And so taking some of that away so the baby can sleep or the toddler can color while mom gets treated is, I think, again, something super helpful and will really remove a lot of those barriers. But I also, I see it in that population, but I also see it with my patients who've had surgery. And I've gone through, unfortunately, a lot of surgery on my knee from basketball, which is part of what got me into PT in the first place. And I know that firsthand, it's, again, hard to set up rides and train to, make sure that you're not, overstepping boundaries in terms of, okay, I haven't asked the neighbor to give you a ride or family members. And so being able to have someone come into the house, and especially during those first, few days or weeks when you're not feeling your best, but that it's important to start your recovery. I think that, again, it starts it right in the beginning, and so that you can start making those gains really early on. And then you can also transition with that physical therapist as, you go into the clinic. And so they can help you with those more long-term goals and bringing you up to speed once you're able to drive and get there get there into the clinic when that's a possibility.